Bill Daughtry back on New York Sports and Beyond on 98.7 ESPN with Dr. Deepak Kapoor. He's from the Advanced Urology Centers of New York. Dr. Kapoor has been a guest with us in the past. Last year he was here to celebrate Prostate Awareness Month. Dr. Kapoor, welcome back to the program.
Bill, thank you so much for having me back. It's always a pleasure.
So I got to tell you, this got personal for me last year. Went to the doctor, physical exam, elevated PSA, and we go through the protocol to the point of having a biopsy done on my prostate. They took 12 samples, as you well know how it all works. It was the best 0 for 12 of my life. I came out, I was fine. And I think the thing that jumps out at me is not all PSAs are the same. You could have an elevated PSA and maybe like me, you had no issue, but still you need to get checked.
Well, absolutely. And I think most major leaguers would love to have that kind of golden sombrero, as opposed to. So congratulations both on taking care of your health and more especially on having a positive outcome. But yeah, Bill, this is an interesting time for us. We're in an era where we're able to really create very customized tools to help us decide how to interpret the PSA test. The PSA is not a one-size-fits-all modality. We adapt the PSA testing both in terms of the relative risk factors that a person has, the size of the prostate, the family history, African-American descent, whether you've been exposed to Agent Orange exposure, the rate of change of PSA over time, as well as a whole variety of other types of genetic and molecular markers that we can use to help us differentiate PSAs that are associated with cancer from PSAs that may be benign. So it's really a tremendous era for us to create customized intervention rather than a one-size-fits-all approach.
Now, of course, Dr. Kapoor, there are no symptoms for prostate cancer. You really can't figure out if you have it or, your body starts functioning in a different kind of way. So let me start it this way. Who's most at risk for prostate cancer?
Well, the risk groups for prostate cancer are those individuals of African-American descent, people with a positive family history of prostate cancer, particularly in male relatives, and our veterans that have served the country that may have been exposed to Agent Orange. Those individuals we tend to watch a little bit more closely. But you hit the nail on the head, Bill, when you said the most common symptom of prostate cancer is no symptoms at all. And so this is a disease that, since the cure rates are so high, if we identify it early, it's really a tragedy when that doesn't happen, because the only way to proactively identify prostate cancer is to look for it.
Talking with Dr. Deepak Kapoor. He is from the Advanced Urology Centers here in New York City. You can reach them on the web at AUCOFNY.com, or you can call them at 844-737-8765. So, Doctor,
that's 8447 Dr. Urology, DRUROLOGY. Easier to remember, Bill.
There you go. Absolutely. So take us back to the PSA testing. What was the controversy concerning that a few years back?
Well, in fact, Bill, the controversy is still ongoing. When we look at PSA testing, the PSA era really started in 1986 when the FDA approved the test. Prior to that time, the death rate from prostate cancer, or let me rephrase that, the 10-year survival from prostate cancer was less than 10%. Since PSA testing started, we started identifying prostate cancers much earlier. And now the 10-year survival from prostate cancer, taking all comers, is probably close to 99%. So it's been a remarkable success rate. The problem is, Bill, that there definitely exists a subset of men for whom prostate cancer is a slower growing disease. And that group of men don't necessarily need to be treated immediately. The problem was, historically, we didn't really have a good way to identify who those people are. So this government agency, which is the same government agency that told women not to get mammograms, said rather than create some type of customized testing protocol, since there's a possibility that some men who get treated may not have needed to be treated, then no man should find out whether they had an elevated PSA, that nobody should have PSA testing. And this was really remarkable because, Bill, 1 week after this agency, which is called the United States Preventative Services Task Force, or USPSTF, 1 week after they came out with their recommendation that nobody should have a PSA, President Barack Obama had a PSA done. And my view of it is, if it's good enough for the President of the United States, it's good enough for every other man in the country. So now what we've seen happen, unfortunately, is a reduction in the number of PSA tests that are being done, a reduction in the number of prostate cancer that are being diagnosed, and now what we're seeing is prostate cancers are presenting at a more aggressive, less treatable stage. So it's really important for men to do just what you did. Take control over your own healthcare destiny. Be empowered, and when you go to your doctor, have a conversation about your prostate, about your PSA test, and say, hey, you know what? Is it appropriate for me to have a PSA test? And sort of insist that you take control, because what we're seeing is that since that government guideline came out, we're seeing fewer number of men being able to be cured for prostate cancer, and that's really a tragedy, Bill.
Yeah, and Dr. Kapoor, I mean, it should be noted, a good doctor is you're not even going to have the conversation, because there'll be some blood tests taken, and that's where the PSA shows up in your blood. It's not like you have to go through anything special or out of the way. It's just part of the routine checkup, one of the things that a good doctor will check for.
Well, it's very interesting that you say that, because sometimes what happens when you get blood work done, a lot of times you don't know exactly what the doctor is drawing. And it's true. The PSA is just another blood test that can be added onto the panel that's being done when you get your routine annual physical, if it's age appropriate for you to have it done. But the simple fact of the matter is, most people don't know what blood the doctor is sending out. And the simple fact is that we are seeing some physicians that, in my mind, are inappropriately responding to to that USPSTF recommendation and not actually doing the PSA test on people. That's the trends nationally. So when somebody draws your blood, you have to be proactive and say, hey, doctor, are you doing a PSA test on my blood? And if the guy says no, he should explain to you why he's not doing it. Because the most common recommendation that are consensus guidelines that the international urology community, and urologists are the individuals that deal with prostate cancer. We're the ones that diagnose it and treat it. And the international consensus guidelines are that all men should have a baseline PSA sometime in their 40s. Based on the results of that PSA and based on the person's individual risk factors, you should then set up an individual screening mechanism. You may get a PSA when you're 45, and if it's a very low number and you don't have a lot of risk factors, you may not need another one for another 5 years. However, if the PSA test has some degree of abnormality relative to your age, or you're at higher risk, it may be more appropriate for you to be checked in a year or 2 years, whatever that may be. But the point is right now that we do not have a one-size-fits-all mechanism for identifying patients with prostate cancer. We can create a truly customized screening mechanism and then a customized evaluation mechanism for every single person based on the advances in technology that we've had in the last 5 years.
Dr. Kapoor, are we making a dent in these numbers? Over 26,000 prostate cancer deaths a year, and the second leading cause of cancer death in men. Are we making any inroads on those numbers?
We absolutely have, Bill. And with early detection, we've reduced the death rate from prostate cancer by almost 40% in this country over the last 2 decades. We've improved the survival from less than 50% in 10 years to almost 99% in 10 years. And what's really important is that we don't want to see all those gains undone by a misguided government recommendation that disempowers men from looking after their own health. The most important message that we have, as you said, there are no symptoms of prostate cancer. You don't find the disease unless you look for it, and that early detection absolutely saves lives.
Well, I'll tell you, as I said, I had a firsthand experience about a year ago. It's uncomfortable. It is a bit scary, but the uncomfortability of it goes away very quickly once the doctor tells you you're okay. So don't wait until you have symptoms, because I'm pretty sure when you do, the disease is spread, and it's really kind of late in the game.
Well, I'll ask you this question, and I think just for the and I can't tell you how much I appreciate you sharing your personal story, because I know sometimes it's hard to open up about something that's so personal, but you're doing a great service to the listeners by sharing that. I'll ask you this question. From the second that your doctor told you that you didn't have prostate cancer, how long did you remember that discomfort for the biopsy?
It went away very quickly. And, my doctor did me a favor because it was right around the holidays. It was right around Thanksgiving. He was going to get to me the day after Thanksgiving. He calls me up the Monday before Thanksgiving and says, look, I'm not going to keep you waiting. I got your test results back. Everything was negative. You are fine.
And you know what? That's what it's all about. This is a partnership between you and your physician. You sit down, you talk about your options, you make an informed decision, and you do the right thing for you. And that is how healthcare should be delivered. You should be empowered to be educated and make your own healthcare decision. And knowing what your PSA is just a piece of information that helps you make the best healthcare decision for yourself.
I mean, Dr. Kapoor, for me, the message is very simple. I mean, we've gone through hell and high water with all kinds of insurance coverages and the like. Now that you are covered, don't be hard-headed, don't be stubborn, particularly if you are a man of color. Go and find out. Get checked. Get tested. Make sure you're okay. I mean, now you have the wherewithal to do it. You don't have to move heaven and earth to do it. And believe me, once you know you're all right, you just move on with life a lot smoothly.
Absolutely, Bill. And again, thanks for having me on to talk. If anybody is looking for more information, as you said, they can go to our website, which, as you mentioned, was www.aucofny.com, or reach out to 8447 Dr. Urology. And with 55 offices throughout the metro area, we've got a physician that's right in your neighborhood that would be happy to help out.
Thank you, Dr. Kapoor. Keep up the great work.
Bill, thanks for having me, and congratulations on the great news.
You can find out more about Advanced Urology Centers of New York at AUCOFNY.com, or you can give them a call at 844-737-8765.